Well, first of all, I would like to ask for your permission to use this video for educational purpose.
Yes.
And as you see, we are doing all our precaution for COVID. And thank you for your patience through going through all that, the screening and so on. Tell me, what were your symptoms before the surgery?
Well, without knowing that it was part of my back problem, last July I developed total incontinence.
Yeah.
Couldn't stand up without emptying my bladder. It has been terrible.
And pain, lots of pain.
And a lot of pain down both legs, and the bottom half of my left foot was
1 to 10, how bad was
numb.
the pain?
About 8, 9, 8, I don't cry, but I was close.
Oh, I know. No, you're a very tough person, but this can be really difficult. Now, this pain has been there you told me, for years,
It's
but
been
in the
there,
last 6 months was getting really bad.
Yes.
Okay.
And what put me over the edge was the incontinence problem.
Yeah. Now, the surgery wasn't that long ago. We did the
2
surgery
weeks.
actually just 2 weeks ago.
Yeah.
And the pain, you told me before the surgery, was up there 8, 9, 10.
Yeah.
First of all, let's separate it. Not the back pain, the leg pain. 1 to 10, how bad is the leg pain?
Right now?
Generally, these days, right?
I still get a little tingle down the right leg outside thigh here. Nothing like it was.
So 1 to 10, how bad was it? How bad is it?
It was
now?
a 9.9.
Okay.
Driving.
So how bad is it now? That pain?
Now it might be a 2, and it comes and goes, so it's none.
Oh, excellent. And the back pain? How is the back pain?
The back pain it's hard to describe. It's like a low, constant throb before. Now the most I notice is when I try to do something and I'm standing stationary, it'll kind of tighten up.
Yeah.
Like a cramp.
And if you want to show the picture, we did it actually 2-level OLLIF just about 2 weeks ago, and that's all what it is. 2 weeks ago, and everything is in perfect position. The screws are well centered. But this is the actual size of those screws. So it takes a while for people to get used to those hardware.
Yeah.
But from what you're describing, first of all, the pain is better. How is the incontinence actually?
0.
Better, gone.
Totally.
The problem is gone.
When I stood up the next day in my hospital room to go to the bathroom, no leakage.
Oh, excellent.
And has been none since. You don't...
No, the incontinent, or as a matter of fact, the continent itself is a function of our nerves. And if there is pressure on the nerves, they can be involved, as yours was. And by us, taking the pressure off, thanks God that incontinence wasn't based on the nerve being damaged. It was based on the nerve just being sleeping from the pressure. So they recovered fast and well. And we are just 2 weeks after the surgery. This is not like the way you are sitting there, the way your symptoms are behaving, that would be impossible with the open surgery. Open surgery people,
yeah.
How long did you stay in the hospital?
Surgery was about 1:30, 1 o'clock on Wednesday, and I left about 1 or 2 o'clock on Thursday.
So just one night, yeah. Excellent. Well, still we have to be careful, and we still will teach you what to do and what not to do. But overall, so far, happy with the results?
Very.
Excellent.
Very.
Excellent. And you see, in certain situations, still even with all the COVID and so on, there are certain situations we don't wait for the surgery. We still provide the proper care. And I think that's important for people to know that there are certain like worsening weakness or bladder bowel problem, or if somebody cannot take care of their basic daily activities and practically they cannot live. In those situations, even with the COVID, with proper precaution, we still can provide the proper help. And you see, we put you back on your life.
Yeah,
Even
it has
in
been
this
a major improvement.
Excellent.
It's so hard to describe not being able to take 2 steps without getting yourself soiled or it's been ugly.
Well, and we are still going to send you to physical therapy to teach you how to behave, what to do and what not to do. But and this has been going on for a while, but some of the problem was getting really worse. But overall, I think we are on a great path. And but it's still going to get even better than this.
Yeah.
Okay.
And
this is just 2 weeks out.
This morning when I first got up, that first 5 minutes was the best I've had in years. And then as you move
makes
around,
me so happy. Well, thank you so much. Any other comment?
Thank you.
You're welcome.
You have made my life so
thank you so much.
Much better.
that makes my day. Okay, thank you so much. I really
Yeah.
appreciate your feedback. Thank you.